Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On today's episode, we're going to hear about how eClinicalWorks is helping an organization provide better care to their patient community. Joining me today is Geli Brown, who is the Senior Director of Quality Management at HHM Health. Geli, welcome to the program.
Thank you so much. I'm happy to be here.
Can you tell us a little bit more about your organization, Geli?
Absolutely. HHM Health is a federally qualified health center. We became a federally qualified health center in December of 2016.
Okay.
Prior to that, we were a volunteer community health center that was started by a school-based nurse who saw a need to treat kids that didn't have access to care, didn't have insurance, or maybe just couldn't afford good quality medical access. So we started from there. We still have that as our basic mission, is to be able to serve those that cannot afford high quality care. We are committed to becoming the health center of choice in North Texas by providing medical, dental, behavioral health, vision, imaging, and now pharmacy services for the community that we serve. We have a very diverse population. Being based in Dallas, our signature or our prime location sits in the Vickery Meadow area, which is heavily populated with lots of culture and lots of diversity. Over 68 languages are spoken by patients that come through our clinic. So we have interpreters on site. We use language line. Our staff reflect the patients that we serve. So folks feel comfortable and know that they're seeing someone that's going to care for them, just like their family.
I'm interested in this goal that you have of becoming the preferred health provider in the area. What are you doing to achieve that goal?
Well, one of the first things we realized we needed to do was to be able to communicate with all the different services and opportunities for caring for those patients. So having, split systems or having to call or fax or, email folks to get information just wasn't very efficient. So being able to use an integrated system like eClinicalWorks allows us to bring all of that into one software system, and everybody can see what's going on with the patient. We utilize Prisma to bring in external records or hospital records. Our behavioral health, vision, and dental teams all use the eClinicalWorks software, as well as our medical. So when you're looking at that patient, you see the whole story right there in front of you. And so we knew that that would help us to be able to provide better care for those patients because everything was right there.
So everything is in one place so that no matter who I was seeing at your organization, they would see my complete record.
They would see your complete record.
And why is having that complete record so integral to your community? Like, how is the reception being now that, from the patient's perspective of going to an organization that can see everything about them?
So as you can imagine, a lot of our patients don't speak English. And so it's very complicated and very difficult for them to navigate the healthcare process and to have to repeat your entire life story every time you go to a different provider. It gets frustrating. And a lot of them get very discouraged because they think you don't understand, you don't have the information, and it's just very frustrating. So to be able to have all of that information and that detail, to say, we already know what's going on, we have all your information here, is very comforting to those patients because now we can make sure we're keeping up with everything and we can keep them on track so that they're progressing and getting better. And they don't have to worry about repeating their story multiple times.
That's probably one of the biggest benefits to the patient, not having to repeat, this is where I live, this is the conditions I have, this is the medications I'm on. You have it all right there in front of you.
Absolutely. And then patients aren't the best historians
That's true.
of their history. So being able to say, no, you did see this provider for this condition 2 years ago, and we already have that information, so we're going to send you back, or we need to update that.
So Geli, I imagine that removing barriers is pretty critical for you to both help patients to access care as well as your staff to provide the care.
Absolutely. With the population that we serve, whether they have insurance or they don't have insurance, because we serve all patients, it really allows us to be able to be that one-stop shop for folks to be able to come, and the quality of service that they receive. Our clinics don't look like, it's a free clinic or a poor clinic. We really try and put a lot of pride into the services that we give. The staff are well trained and highly motivated to serve this population. So when we get, for example, a woman from Burma who has never had a pap smear before, and we're able to set her up with one of our gynecologists to see, does she have cervical or uterine cancer, explain to her what contraception is, and be able to access those services in real time, day of that appointment, has really been huge for us in the community, because they know there's not going to be a delay in care. They know that they're going to see someone that's going to take care of them right then and there.
And how has eClinicalWorks helped to remove some of the barriers that people have to accessing care?
Sure. So we utilize a plethora of eClinicalWorks services, everything from the way they enroll and being able to do that, to check in electronically using Helo to be able to pay for their appointments ahead of time, using the patient portal so that they can send messages so they're not having to sit on the phone waiting for feedback, to when they're actually in the clinic receiving services, we're able to see everything across the board, pull in those external records, as well as communicate with the other providers. So we're able to say, we have a patient that is, maybe it's one of our postpartum follow-up ladies, and they're there and they're screening high on postpartum depression. They're able to immediately message one of the behavioral health counselors within our system, and they can either do a virtual visit or they can come up to the clinic and see that patient in real time. So just being able to have all the services available there and being able to see, I see we've connected you with this service before, I think we need to bring them back. And being able to see those notes to make sure that everything is being handled and taken care of in real time.
Now, before we got on camera here, you were telling me a very interesting remote patient monitoring story.
Yes.
Talk to me about that.
So we are so excited to be able to offer remote patient monitoring for some of our more chronically ill patients that can't necessarily, maybe it's a transportation issue, or maybe they no-showed their appointments a lot because they felt like they couldn't pay for the visit or other things were going on. So we took our very out-of-control hypertensives and our out-of-control diabetics and launched remote patient monitoring with devices so they could monitor their numbers at home. And this one gentleman, we were getting these really weird, just nonsensical numbers and values for him, like a blood sugar of 51 or 53 and a blood pressure of 71 over 110, and we're going, these can't be right. Maybe he's confused or he messed it up. So we reached out to him and we were like, what's going on? And he was like, well, I know you needed these numbers, but I don't really understand this, so I was just giving you numbers. We were like, oh my gosh. So you don't know what you don't know until you ask the right questions, right? So we brought him into the clinic, we were able to educate him on the devices, educate him on his medication, and get him all sorted out. He went back home, he was able to use the devices and report back to us real numbers, and now he's doing great. And he's so grateful that he doesn't have to, continuously come up to the clinic for when he's having problems, and he's been able to manage his condition a whole lot better.
Amazing. That's an amazing story. Yeah. You also had a pretty interesting story about how you're using Prisma, I think that's what it's called, inside eClinicalWorks, to retrieve like a new patient's information that you didn't have from before.
Correct. So, our running joke is we don't have to make up these stories, because if it can happen, it will happen at HHM Health. And this was a brand new patient. He was an Afghan refugee that was coming in for his very first appointment with us. And as the medical assistant was calling him to the back to triage with vitals, one of the providers just happened to be standing in the hallway and was like, wait, stop. Like, don't move, call 911, let's get a chair, let's get him seated. And we're kind of going, what's going on? Like, why are you stopping us in the hallway? And it turns out that the patient was in the process of having a stroke. She noticed the symptoms. We were able to go in and pull hospital records from Prisma so that she could see previous history, what medications he was on, a past EKG that he had had. And we were able to get him immediate help so that he didn't have long-term effects from what was going on. And he was ever so grateful and still comes to our clinic now for his follow-up appointments.
That's probably one of the better stories about how interoperability and having access to medical records that weren't yours really paid off.
Correct, because without those previous records, it would have been a shot in the dark as to what was really going on with this gentleman.
Oh, incredible, incredible. Gela, where can people go to find more information about your organization?
Absolutely. So we are located in the Dallas area. You can go to our website, hhmhealth.org. Or you can just give us a call at 214-221-0855, and any of our wonderful staff would be happy to help.
Gela, thank you so much for sharing the information you did.
Yes.
Thank you for being on our program today.
Thank you so much for this opportunity. And you know, I'm just very grateful to eClinicalWorks for offering us all these options so that we can become that healthcare of choice.
Awesome, awesome.
Thank you.
Hey, if you enjoyed this interview as much as I did, we'd love for you to check out more great content like this at healthcareittoday.com. I'm Colin Hung. Thanks for being with me, and we'll catch you on the next video.